Welcome to today's lecture on the fascinating topic of craniofacial anomalies. In this comprehensive script, we will explore the embryological basis, classification, evaluation, and management of these anomalies. Additionally, we will dive into specific conditions such as syndromic and non-syndromic craniofacial anomalies, cleft lip and palate, craniosynostosis, orthognathic surgery, temporomandibular joint disorders, Treacher-Collins syndrome, craniofacial microsomia, mandibular distraction osteogenesis, and speech and hearing disorders associated with craniofacial anomalies. So, let's begin our journey into the intricate world of craniofacial anomalies. During embryogenesis, the skull and face undergo remarkable development. This topic will elucidate the formation of facial prominences and the fusion of facial structures. We will discuss the intricate molecular and cellular mechanisms involved in craniofacial development, which are crucial for understanding the pathogenesis of craniofacial anomalies. Craniofacial anomalies encompass a wide range of conditions with diverse etiologies. In this topic, we will delve into the various classification systems used to categorize these anomalies. We will also explore the diagnostic methods and imaging techniques employed for accurate evaluation and diagnosis. A subset of craniofacial anomalies occurs as part of syndromic conditions. We will focus on well-known syndromes such as Apert syndrome, Crouzon syndrome, and Treacher-Collins syndrome. Our discussion will encompass the pathogenesis, clinical features, and comprehensive management strategies for these syndromic craniofacial anomalies. In contrast to syndromic craniofacial anomalies, non-syndromic anomalies occur independently of associated syndromes. This topic will explore isolated conditions such as cleft lip and palate, craniosynostosis, and facial asymmetry. We will analyze their etiology, underlying mechanisms, and various treatment modalities employed for their management. Cleft lip and palate is one of the most common craniofacial anomalies. In this topic, we will unravel the causes and pathogenesis of cleft lip and palate formation. Furthermore, we will explore the comprehensive range of surgical and non-surgical interventions utilized for the management of this condition. Craniosynostosis involves the premature fusion of cranial sutures, resulting in abnormal skull shape and potentially detrimental intracranial pressure. This topic will focus on the diagnosis and surgical treatment of craniosynostosis, discussing various imaging techniques and surgical approaches employed in managing this anomaly. Orthognathic surgery plays a pivotal role in the management of craniofacial anomalies. Facial asymmetry, malocclusions, and jaw deformities can often be corrected through this specialized surgical approach. We will explore the indications, techniques, and outcomes associated with orthognathic surgery for craniofacial anomalies. Craniofacial anomalies can lead to various temporomandibular joint disorders, resulting in pain, limited jaw movement, and other related symptoms. Our discussion will encompass the diagnosis and treatment options for these temporomandibular joint disorders in patients with craniofacial anomalies. Treacher-Collins syndrome is a prominent craniofacial syndrome characterized by facial deformities, hearing loss, and additional associated features. This topic will provide an in-depth analysis of Treacher-Collins syndrome, covering its etiology, clinical presentation, management strategies, and associated challenges. Craniofacial microsomia is a condition characterized by underdevelopment of the face and jaw on one side. In this topic, we will examine the clinical presentation, diagnosis, and treatment approaches for this specific craniofacial anomaly. We will discuss both surgical and non-surgical interventions employed in managing the condition. Mandibular distraction osteogenesis is a specialized surgical technique utilized in the management of craniofacial anomalies. This topic will focus on the indications, surgical techniques, and outcomes associated with mandibular distraction osteogenesis, which has shown promising results in correcting certain craniofacial anomalies. Patients with craniofacial anomalies often face speech and hearing difficulties. We will explore the range of speech and hearing disorders that may occur in these individuals and elucidate the evaluation and management strategies employed to address these challenges effectively. In this comprehensive script, we have journeyed through the embryological basis, classification, evaluation, and management of craniofacial anomalies. We have explored a variety of topics, ranging from syndromic and non-syndromic anomalies to specific disorders such as cleft lip and palate, craniosynostosis, Treacher-Collins syndrome, and craniofacial microsomia. Additionally, we have examined surgical interventions, orthognathic surgery, temporomandibular joint disorders, mandibular distraction osteogenesis, and speech and hearing disorders associated with craniofacial anomalies. Understanding these complex conditions will equip future healthcare professionals with the knowledge and skills necessary to provide comprehensive care for patients affected by craniofacial anomalies.